This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. Let me start with a question. What happens when your body keeps telling you something's wrong, but no one believes you? That's the silent struggle of millions living with interstitial cystitis, also called Bladder Pain Syndrome, or ICBPS. It's a chronic condition that affects the bladder and pelvic region, often misdiagnosed or misunderstood, but it's very real. And today, we're unpacking what it is, how it works, and why we must pay attention. ICBPS is a condition where patients feel bladder pain, pelvic pressure, or discomfort, often with urinary urgency and frequency. Imagine your bladder as a balloon with sensors. In ICBPS, those sensors are hypersensitive. The pain isn't just in your head. It's often due to a breakdown in how the body processes pain signals. Unlike urinary tract infections, ICBPS isn't caused by bacteria. There's no infection, but the symptoms can feel even worse. That's why many patients, especially women, go through years of misdiagnosis. The average time to proper diagnosis is often measured in years, not months. Biologically, ICBPS is a breakdown in bladder lining or altered pain signaling. Some patients have identifiable lesions in the bladder called Hunter lesions. Others may have pelvic floor dysfunction, inflammation, or overlap with conditions like fibromyalgia or irritable bowel syndrome. Think of the condition like a faulty alarm system. Even when there's no danger, your body keeps firing off warnings: pain, pressure, urgency. Over time, this constant activation affects not only the bladder, but the nervous system and even mood regulation. ICBPS isn't new. It has been described for over a century, but our understanding has evolved. The most recent AUA guideline, updated in 2022, synthesizes decades of data from over 150 studies. The evidence supports a structured, patient-first approach to diagnosis and treatment. FDA-approved treatments include pentosan polysulfate, though with caveats due to vision risks, as well as intravesical therapies like DMSO and onabotulinum toxin A for severe cases. So why don't more people know about this condition? There are many reasons. First, ICBPS doesn't have a single biomarker, so diagnosis relies on symptoms and exclusion of other conditions. Many physicians, especially in primary care, may not recognize it quickly. There's also stigma around chronic pain, pelvic discomfort, and especially women's health complaints. Insurance coverage for physical therapy or advanced procedures can be limited, and media coverage has lagged behind. For patients, the experience is often overwhelming. Imagine needing to urinate 40 to 60 times a day, or dreading intimacy because of pain. Many patients report discomfort that worsens with bladder filling and only improves temporarily after urination. Treatments vary, from lifestyle changes, stress management, and bladder installations to oral medications and procedures. Pelvic floor physical therapy can be especially helpful in patients with muscle tension and trigger points. For others, neuromodulation or even surgery may be necessary. Not every patient with ICBPS is the same. That's why individualized care is essential. Some respond well to conservative therapies, while others need multimodal treatment. Hunter lesion patients, for example, may benefit from targeted treatments like fulguration or steroid injections. I approach each case with a diagnostic lens, looking not only at the bladder, but at the whole person, their pain patterns, mental health, and history. For example, patients with high stress or trauma histories may have a central sensitization of pain, requiring a broader strategy that includes mental health support. The goal of treatment isn't necessarily a cure, it's control. Symptom reduction and improved quality of life are achievable for most patients. With the right approach, we can reduce flares, lower frequency, and help patients reclaim activities they once avoided. In one study, pelvic floor physical therapy improved symptoms in over 80% of patients with pelvic tenderness. Multimodal treatment, including medication, stress management, and lifestyle adjustment, often leads to measurable improvements in both physical and emotional well-being. We're seeing exciting developments in the future of urology and ICBPS care. From AI-guided diagnostics to precision treatments based on phenotype, the field is evolving. New imaging tools, better pain mapping, and even genetic markers may soon help us identify ICBPS earlier and treat it more effectively. Telehealth and multidisciplinary care models are improving access, and awareness is growing, not just among urologists, but across all of medicine. Why do I do this work? Because these patients are often dismissed. They've been told it's in their head or that nothing can be done. But that's not true. When we listen, when we believe them, and when we bring evidence-based care to the table, we give them back their life. I've seen patients go from feeling hopeless to hopeful, from constantly planning their life around a bathroom, to planning vacations, relationships, and careers. There is a better way. And it starts with recognition, compassion, and relentless pursuit of solutions. Thank you for joining me on the Global Men's Wellness. I'm Dr. Judson Brandeis. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.